The closure of the Delta Health Neonatal Intensive Care Unit, or NICU, came amid losses of $1 million a year. The trend of closing down operations like this comes as no surprise to many, including experts who say closing operations like the NICU or surgical or pain clinics like Greenwood Leflore Hospital has done could come with an even bigger price.
I think it's all like a domino effect. So if you don't have that access to just basic health care, making sure their wellness is taken care of, making sure their chronic illnesses are taken care of, then they get more ill and then have to go to the hospitals and create these bills that the hospital takes care of them, but they don't get reimbursed for.
The Delta News has reported on the troubling financial health of the ailing Greenville Hospital, along with the separate troubles at Greenwood Leflore Hospital. The Delta News requested an interview with interim CEO Iris Yeldell-Stacker weeks ago. After questioning our documented reports on the hospital's situation and the Washington County Supervisor's concern about it, Delta Health told us Stacker wouldn't be available to speak with us. The Delta Health Level 2 NICU was the only one in the Delta, serving an average of 150 newborns each year since 2019, according to Mississippi Today. As the Delta News reported, Delta Health has a current income of negative $13.2 million for the entire system. How's that?
Reimbursement is down from insurance providers, from Medicare, Medicaid, all those type of things. And people are seeking health care in health systems such as hospitals, and they don't have the funds to pay their bill. And so the hospitals are providing the care, but they're not being reimbursed for it.
The problem is especially bad in Greenville. Figures released from Delta Health show the Greenville Hospital makes up more than $300,000 of the company's $13 million hole, with the rest coming from other medical centers and groups. Mississippi Today reports Yeldell-Stacker also cited increased costs for contract labor, which can cost 3 times more what normal staff make in salary. Along with that, the hospital pays $1 million a month back to Medicare from a $14 million Medicare loan. How do healthcare businesses like Delta Health or Greenwood Leflore survive? Dr. Baskin paints this scenario.
For instance, this is just an example. Come to the emergency room because they think their blood pressure's up. They're not having any chest pain. They're not having any stroke symptoms, but they just think my blood pressure is up. Instead of running them through the system, maybe triaging them back into a clinic or something where the cost would be less, maybe coming up with some type of system on the front end so that those patients don't run through and bill that cost.
Lower costs suggest a better chance of reimbursement, say experts, reimbursement that could stop the bleeding at these businesses and help create some stability. Dennis Turner, the Delta News.